Coming up on American Medicine Today. Ever since the pandemic, healthcare patients have been desperate to know their rights when it comes to mandatory treatments. Laura Bartlett tells us about the website she founded which promotes patient advocacy. Then, Debbie lived with neck pain for 20 years. After reaching her breaking point, she finally sought help and found the patented Bonati spine procedures. Now, Debbie is back hiking and enjoying retirement. Finally, Dr. Bonati explains reflex sympathetic dystrophy, or RSD. What are the symptoms of RSD in your spine, and how does the Bonati Spine Institute go about treating the root cause? Find out coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Euchre. So a website is dedicated to providing people with proper knowledge regarding their rights as healthcare patients. And it's been exploding with traffic since the pandemic. Joining us to discuss is Laura Bartlett, founder of hospitalhostagehelp.com. Thank you for joining us, Laura.
Thank you for having me.
Your brother, Dr. Richard Bartlett, received backlash for using an asthma drug, I believe it was called budesonide, to help COVID patients in the early days of the pandemic. And you were assisting him at that time. Can you kind of walk us through what that was like?
Sure. Early 2020, there was a lot of just lack of information on what people could do. And,
Yes.
We were part of helping people know that you could do some things early, like budesonide, and you could
Yes.
even do it in hospitals for COVID. And so my involvement at first was just getting the word out and helping spread that good news. And I just kind of jumped off of that and started helping people in hospital because people were being denied their informed consent. They were not being told the risk, or the risks were downplayed for certain medications.
COVID made hospitals places for profit rather than healing. Can you explain what that means?
They were told you're going to get what you get,
Yes.
basically. That
Yes.
involved a protocol that was rolled out uniformly, and it involved something they didn't want, for instance, like remdesivir, or maybe a total body steroid like dexamethasone.
Mm-hmm.
They were just ignored, bullied, at times coerced into doing things. They were scared. They were ashamed. They were shamed by doctors. And really the only person that could have given them informed consent or received the informed consent from the patient is the doctor. So I really don't know what's going on with the hospital at large or the institution of medicine. All I'm dealing with is the doctor himself. Mm-hmm. And I have some great news. I was on Dr. Mercola's program just the other day, and he glowingly endorsed. As a matter of fact, I think his exact words were, "These documents that I have that ensure almost 100% guarantee that your informed consent has to be acknowledged." Yes. This document that was developed as a revision, Jehovah's Witness document, which is well known, the Jehovah's Witness capacity to refuse blood donations. Mm-hmm. Is virtually 100% going to get your consent acknowledged and accepted and respected so that you don't get that thing, whatever it is, whether it's COVID tainted blood or if it's remdesivir or whatever. Our document is a revision of that Jehovah's Witness document that they walk into the hospital with. And everybody knows, everybody's put on notice that is part of the care of that patient. And so this document is at ourpatientrights.com, plural, ourpatientrights.com. So what this is basically a document that you fill out ahead of time, and you walk into the hospital with it. There's specific instructions. They need to be delivered in a specific way. So it's legally delivered and served to the CEO of the hospital. Everything's delineated there at ourpatientrights.com. Very simple. It's very easy. It's free.
What you're doing is very important, which is why obviously we wanted to have you on. And we did have your brother, Dr. Richard Bartlett, on right as COVID was kicking off, and he was getting all of this bad press and whatnot. I think we dedicated an entire program to what he was doing. Doing this show is what made me realize that you can question your doctor, wherever you go, your dentist, your whomever, that we do have rights as patients to not just blindly say, oh, that's what should be done. Okay. I think most people, again, including myself prior to this show, would just say, okay, all right, I understand. So what you're providing is a knowledge, as you say, and knowledge is power.
I have to tell you that a lot of people knew that and they asserted it. People that I was helping all over the country, from Washington State to New Jersey. There were a lot of doctors that said, it's best for you that you get remdesivir. And the patient pushed back and said, no, I'm not consenting. Correct. And verbally, that was not acknowledged. So they would verbalize they did not consent to certain things and it was ignored. Correct. So what we learned from this is that the absolute best way is to put it in writing per the AMA, American Medical Association's 2.1.1 ethics, code of ethics. And I'll read that for your listeners so that they know why this is being recommended.
Yes.
When the patient surrogate has provided specific written consent, the consent form should be included in the record. So when you do this prep work before you even walk into the hospital, I encourage everybody to do that. Mm-hmm. Get the document, fill it out, choose the things that you want to choose. And so if there's something that you want on there, write it in, change the template, revise it, or do your own. Just get your informed consent in writing. I'm imploring you. It's going to have a great effect on the doctor when he sees that it's in the medical record, because it will be immediately put into the electronic medical record. And at that point, if you were to say, no, I don't want remdesivir and get remdesivir, for instance, or no, I don't want a COVID vaccine, because that's what's being pushed right now is COVID vaccines. 18-year-olds are especially at risk right now. 18, 19, 20, 21, males have adverse effects, females too, but that age group right now, whether you go in for appendicitis or an emergency appendectomy, they're being routinely asked what their vaccination status is. And if you do not want that mRNA jab,
don't get it.
Verbalizing it isn't enough, we're learning. You need to put it in writing. That's what's going to give you the best coverage for having that respected.
Touch upon hospitalhostagehelp.com, which I found interesting too, in the sense that you said people use that term. I feel like a hospital hostage.
Yeah, and they felt like they were kidnapped. They were told they couldn't leave the hospital. I would say that that's kind of a hostage situation to a lot of people. Right.
Yeah.
And that's a lie. That's a lie. You can leave the hospital AMA against medical advice.
Absolutely.
And I've had several people who survived once they heard that they could do that from me. They didn't hear it voluntarily from the hospital doctor. But the doctor said they couldn't leave, actually.
Those are the threats they do. They're real. They're happened to family members of mine.
The workaround is to get your informed consent in writing, like a lot of the people I've helped have done. And the situation turned around in minutes once they got this document that this is something that's working.
We truly appreciate what you're doing and advocating for the people. Thank you so much, Laura Bartlett, for being on the program.
Thanks, Laura.
Make sure you stay tuned. We'll have more after the break. You're listening to American Medicine Today.
I went to Dr. Bonati and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery, because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy, and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Visit askbonati.com.
My name is Debbie Gale, and I live in Marlington, West Virginia. I am 61 years old, and I have worked as a hospital pharmacist for 38 years. I have had pain in my neck for 20 years, and I have been told from pain management specialists and my neurosurgeon that it's partly genetic in that it's arthritic in nature or degenerative disc disease with stenosis, but also due to the nature of my work as a pharmacist, where we stand bent forward a lot, especially with our heads bent downward over a prescription counter checking medication, and then also sitting at a computer with our necks jutted out and that type of thing. So just continual pivotal motion of, the neck and the head downward over the years caused me damage.
Though she dealt with the neck pain for decades, Debbie noticed that her condition was getting worse.
I have not been without pain since 2006. The chronicness of the pain. I would have intermittent pain, and I would take nonsteroidals and Tylenol. But in 2006, my pain became chronic, and it never left after that. And I started at a pain center, and I have received over, from 2006 till 2011, facet joint injections, occipital nerve blocks, had cryoablation done at West Virginia University Pain Center. And all of those treatments for me helped temporarily. It was like putting a Band-Aid on an open wound. I had actually seen neurosurgeons before, and they had recommended surgeries for me, but I was very frightened, and it didn't sound like anything I wanted to do. And so I just pretty much suffered with the pain, because as a pharmacist, I didn't take opioids and that type of medication because it altered my, consciousness or ability to concentrate, and when I did work, I wanted to have a clear mind for my patients. So anyway, I basically stuck to the Tylenol and the nonsteroidals, which is like Motrin and Advil, but after a while, nothing helped me. And then eventually I became so compromised. I was laying in the bed 18 or 24 hours a day. I barely worked. I had a full-time job that I had to cut back to part-time or per diem or a few days a week or a few days a month, because I was just in such excruciating pain in my neck that I couldn't do anything. And I actually was so distraught about what I was going to do and didn't know what to do or where to turn. The pain management wasn't working for me. I was seriously contemplating suicide.
Thankfully, Debbie ran into a new neighbor that told her about the Bonati Spine Institute.
So we had moved to this area. We had retired here, and actually my neighbor who lives down the road had her daughter to the Bonati Spine Center. They're from New Liberia, Louisiana, and once I got to know her a little bit and told her about my pain, then she highly recommended the Bonati Spine Center.
Encouraged after hearing her neighbor's story, she started doing her research.
When I found out about the Bonati Spine Center, I went on the website and was looking around, and I saw where you could send an MRI. Well, I had one that I could send that was fairly recent. And very quickly, someone called me about it. He's like, Mrs. Gale, I've reviewed your MRI. I see, some problem areas that you're having. And based on, the information, like you could type like a little text message that you've given us, then, we have procedures that can help you. Upon further discussion with my husband, we decided that we would travel there.
After traveling to Hudson, Florida from West Virginia, Debbie was impressed by the facility and staff at the Bonati Spine Institute.
And then when I got there, the first thing I thought of when I saw it, because it's such a beautiful center, it was like a place for like the stars or professional people. And everywhere I went in that center, everyone was professional. They were friendly. They had my best interests at heart. It was just good patient care. And especially being in the healthcare field and being at pain centers for several years, I was very impressed with the way that they worked me up in the clinic. And, he said, this is a thought process that we go through. This is how we determine what we feel like, based on what you tell us and what we see on your imaging, is your worst area, because that's what we want to treat first. And I found that really amazing too. And I thought, well, that only makes sense. I never expected to hear that. But that made sense, that they want to treat the worst pain first.
The exclusive Bonati spine procedures are performed under conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
It was all done outpatient, and it was done under conscious sedation. I was laying there on the table, face down. The nurses were saying, Miss Gale, you're finished. Your surgery was successful. We need you to tell us about your pain. And to me, I was thinking pain. Well, I don't feel any pain, but what was just coming over me, and the feeling that I realized was that doom and gloom, that hopelessness and that despair that I had gone in there with, where I wanted to kill myself, that was gone. And I felt joy, I felt relief, and I started laughing, and they said, let me help you up. And I said, no, I can get up. I can get up by myself. And I walked out of that operating room, and I remember raising my hand saying, hallelujah, praises be to God, because I didn't know I was going to get that relief. I didn't know that they were going to make that kind of a difference in my life. I didn't know that. And that horrible, horrible pain that I had when I went in there, I've never had that again.
Patients of the Bonati Spine Institute are often surprised to learn they don't have to wear uncomfortable braces after surgery, and the only therapy required of them is to walk about an hour a day.
As part of your therapy, even on the day of your surgery, they have you walking. So I knew how important walking was. I like to walk anyway.
Debbie tells everyone she meets suffering with neck or back pain about the Bonati Spine Institute.
I have actually been passing it along about the Bonati Spine Center. What they did for me was just so monumental in my life that I have been sharing it with many, many people when they talk to me about their pain. And, certainly I'm not a neurosurgeon, but I know what they've done for me, and I can tell when somebody's in pain. I tell everybody that I know, everywhere I go, if somebody's in pain or they're thinking about surgery, and actually I've been talking to my dentist about it also, because he's had some nerve ablations and a hip replacement and needs some other, work done. And he told me that he was getting ready to call the Bonati Spine Center. I am not a paid spokesperson for Bonati Spine Center, but I personally speak to what they did for me all the time, because they did give me my life back.
Debbie is now enjoying her retirement with friends and family, pain-free.
And before I went there, like I said, I was in that bed 18 hours a day, and I didn't really want to live, but now I'm actually enjoying my retirement. My husband and I live in West Virginia, and we're in this area because, my husband was a park ranger, and so we retired to an area where has outdoor activities. We live on a river. We live on the Greenbrier River. We go kayaking in the spring, the summer, the fall. We have the Greenbrier River bicycle trail, or river trail rather. It's 75 miles, and we bike that. And I actually will walk that when the weather is nice, 3 and 4 miles a day. We are able to do more things together. We took a hike a couple of weeks ago down at Watauga State Park, and we hiked 4.7 miles up rocky terrain, and it took us 4 hours. And I would have never been able to do that before. But after the spine surgery, I remember that summer, because I had my first surgery in February, and some friends came up for the weekend, and we took a hike, and they're like, because that was probably 3-4 months after my first neck surgery, and my friends were like, oh, should you be on here? Should you be doing this? And I'm like, oh no, we can do this. I can do it.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
The recovery was pretty easy. I was able to walk around after surgery with no problem.
And when I got up off that table, it was like, like a reborn again. When I was able to walk off that table and walk out and go for lunch. I went in there at 10 o'clock, got operated on. At 12 o'clock, I was walking out on my own.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
This is the honest to God truth. And was recovering, I didn't feel anything. The pain that I was suffering is gone. I can go back to work in like 3 days.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting, So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. And like, okay, let's see how you do. And I was rolling with everybody, and I'm in the advanced class. So that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, Doc, we also have something called RSD, and it causes swelling.
The name is reflex sympathetic dystrophy.
How do people typically get it? Is that just degenerative, or does somebody have to have been in an accident?
Usually it's associated with failed surgery or with some type of an accident that traumatized part of the body.
Yes.
Usually affect the extremities.
Yes.
More frequent the legs.
Mm-hmm.
And the patient has a sensation of swelling and a sensation of pain.
Okay.
And the pain is so intense that they cannot even touch their legs with a sheet when they go to sleep.
Mm.
So they need to sleep practically in a sitting position, or sit with the leg hanging on the floor, or sometimes without covers. It's a very bad syndrome.
Yes.
Because it's permanent and it's constant. And one of the things that you appreciate clinically is that the patient is practically depressed because nobody can do anything.
What do doctors typically tell somebody that comes in and they show RSD?
And to add on that, Doc, is it something that tends to be misdiagnosed, or they miss what the actual diagnosis is?
Not really, because it's very, very clear that the patient has the sensitivity on the extremity is very intense and swells.
Right.
Okay.
And sometimes it's associated with surgery. Some other times I associate it with trauma.
Okay.
But what really happens is the patient overnight, a normal patient that has surgery or had a trauma, overnight they start to feel a lot of pain in the extremity. If that pain doesn't subside, then the extremities start to become retaining fluid. And sometimes the arm or the leg is 2 or 3 times the size of the normal leg.
Wow.
And it's red like a...
Sore.
Yeah. It's like a big inflammatory process all over there.
Okay.
And also, if you have hair, the hair also is being practically like somebody shave you. And the leg now looks 3 times their size. The toes have practically look like little knobs. The skin looks red and shiny. And you cannot touch it. As soon as you touch, the patient has extreme sensitivity pain. This type of reflex sympathetic dystrophy is so intense in some situations that the surgeons decided to amputate the extremity.
That is the solution for most people?
Yes.
We don't know how to fix it, so just lop it off.
Wow.
The problem with that
That's
is not only when
life-changing.
you amputate the extremity,
Yes.
the root of the nerve that is affected still will develop pain. So now the stump is going to be painful.
Wow. So they would undergo something so invasive to then still have that agonizing pain.
Yeah. I have the fortune and misfortune to have a patient with sympathetic dystrophy.
Sure.
That person had surgery and was affecting the pathway of the fifth nerve root on the lumbar spine. So she had hip pain, she had pain on the outside of the leg, pain on the outside of the calf. The leg was all swelling, and every week was bigger. and was shiny and was red and was very sensitive to the touch, and the toes were extremely painful.
So agonizing.
So looking at the path of the pain, we look at the MRI, and the MRI didn't look abnormal. But then we knew that was surgery in that area, and we knew that probably the nerve was trapped in someplace.
Previous to coming to you?
Yeah.
Okay.
And then also the patient had a foot drop.
Got it.
So the ankle was unable to move the foot.
Wow.
What we did is we opened the canal for the fifth nerve. We have, remember that the fifth nerve root is born in between 4 and 5 lumbar vertebrae, but exit between 5 and S1.
Yes.
So you need to do 2 procedures to get to the nerve.
Sure.
So we did the first procedure, and the patient immediately felt decrease almost 90% of the pain. And the next day after the surgery, the leg looks almost normal.
Wow. And it was 2 to 3 times its normal size previous to the surgery.
Yeah, it was just fluid that was retained.
And you didn't have to amputate her leg.
Well, wait a minute. We never thought in that.
Right.
Well, the next thing that happened is we did the 5S1. When we did the 5S1, we recovered the foot, and the foot drop becomes corrected.
Wow.
So we correct the foot drop, the swelling disappeared, the swelling on the toes disappeared, it looked normal. And the sensation was totally normal, and the motion was normal. And the patient in 2 days was walking normal, and she had a year of a problem.
Is there ever a point that it is so advanced that even your procedures wouldn't help?
The body is amazing. If you just give to the body the right solution, the body makes the work and recovers. The nerve recovers totally. Okay? For us to look at somebody who has a foot drop that around maybe 5 years ago, the people will call, you have a foot drop, nothing we can do about. Today, we can recover that.
Wow. So nerves regenerate when given the opportunity, and the area that was compressed decompresses. It's a really amazing results with the Bonati spine procedures. We'll have more on the topic on a future episode. To find out if you're a candidate for the Bonati spine procedures, visit askbonati.com. And if you want to hear from the patients themselves who have been treated, search the Bonati Spine Institute on YouTube. Thanks for listening and watching American Medicine Today. If you have any comments or questions, contact us at the number below. Tweet at Dr. Bonati. For a previous episode, head over to Rumble and search American Medicine Today.